being as the pump is quite expensive, and if I was in a situation where the pump would need to come off, say I was going into some kind of surgery or something, I'd obviously want them to be extremely careful with it and put it and suspend it and put it in a place where it wouldn't be disturbed or touched. I'd want them to obviously be really careful with it because it's expensive and it's extremely important because it's my pancreas.
I think it's really important that people who can see you in an emergency setting, so coaches, first responders, teachers, are aware of the insulin pump. We're going to see a lot more children, youth, young adults on insulin pumps soon, so it's not going to be something uncommon.
So a pump is a system to deliver insulin, both at a constant rate and as boluses when you need it. It also records a lot of information, which we can then download to the computers, and the families and the physicians can look at that to see how the child or adolescent is doing over time, which is very beneficial. The pump, however, is a machine that needs lots of human input, needs lots of TLC, and it needs guidance and direction. It will do all the little picky points for you, but you still have to check your sugar several times a day. You still have to think about how many carbs you're having to input it. You have to push the button on the pump even when the alarm goes off. Some of the kids forget to do that to give themselves boluses. So it still puts a lot of onus on the human beings to manage their diabetes.
The first pump that I'll show you is one called the Omnipod. It's a pump that doesn't have a tubing. So it's like this is a remote control. It happens to be the patient's blood glucose testing machine as well. But this is what the person would use to deliver their insulin. Important for you to know with this doesn't have to be attached to the patient. So this could be in someone's purse, it could be in their knapsack, it could be in a number of different places. So this is the actual pump. This part here is the pod. This is a pod that's actually full of insulin, and it is stuck on a patient, and it can be any place that people would take insulin. It could be on their abdomen, it could be on their arms, their legs, their hips. So what it would look like is it basically just is a pod that's stuck on, and the insulin's being delivered through here. This is like the remote control that controls it. Okay? Another pump that's out there, this is the Animus pump. This one is green, but it can be many different colors. It can be blue, pink, black, silver. So this is a tubing pump, connects up to the same thing. All pumps would be worn in the same place. They would be in your abdomen, your arms, your legs, your back, your hips. This one has a tubing. So this would be attached to the person, could be attached in a number of different places. A lot of times people may wear them on their belt, may wear them in their pocket. Sometimes people have special belts that are made that it clips onto, and it may clip, you may find it on their back. A lot of times for ladies, they wear it in their bra. So it might be in their bra, it might be on the side of their bra. So there can be kind of all kinds of inventive places where you would find this one, but it would be attached. Important to know there are longer tubings. This is probably the average length of tubing, but there are some that are even longer, because sometimes I've had patients that will wear it in their boot. So it's got a longer tubing, runs down their leg, and it's in their boot, but it should be attached. Third pump, the Medtronic pump. This one is a black pump. It could be clear, it could be purple, it could be blue, it could be different colors, but generally it's going to look the same. Same thing with this one. It has a tubing. It's going to attach onto the body in all the same locations. It's going to as well have an option of various lengths of tubing. Fourth pump, this one, the Accu-Chek Spirit. This is a pump, would be the exact same thing, would have a tubing, be attached to the body, and you would wear all of the pumps really in any of the same places, and it would work the same.
My insertion sites, I really only have one option for them, and that's in the high area of my butt, because that's where I have really the only amount of fat on my body that can hold an insertion site. For other people, people with a little bit more fat around different parts of their body, they can maybe use their thighs or their waist, and some people can even use their arms. But the main thing is to have an amount of fat that an insertion site can go into, and is not going to hit any muscle or tissue that would irritate the site and make it bleed, or the insulin wouldn't get in properly.
On the back of all of the pumps are 1-800 numbers. They're a technical support line. Certainly they're not going to offer advice on managing blood sugars, but they can offer technical advice on button pushing and advice on to do with the tubing and insertion sites with the pumps.
The 800 number is right there, and then any personal information about your pump, like the reference number or whatever would link this pump to you, is on the back. So if you need to call them, anything you need is always attached to you.
If I was in an ambulance or if it was emergency room, I just want them to know about obviously low blood sugar and high blood sugar, and say my blood sugar was high, to maybe give a little bit of insulin to correct the sugar, or if I was low, to disconnect it to make sure that I wouldn't go any lower.
I'd expect to, if capable, take part in my management. I mean, I understand that the healthcare team at the hospital would want to be involved with my management to make sure that they know what's going on as well. But there's definitely a collaboration that can happen in a hospital setting to ensure that management can continue on the pump.
If a patient wants to continue to use their pump, 3 things need to be considered. Is the patient capable of continuing to use the pump? If that is the case, they have to be alert and oriented. They have to be willing to measure their blood glucose 4 to 7 times per day, and to report to the staff if there's any difficulty with that. If they're hyperglycemic, so their sugar is greater than 14 millimoles per liter, they have to have access to keto testing, either capillary blood testing or urine testing, and have to be able to act upon the results. They have to be willing and able to change their pump site if necessary. And they have to be competent in pump management. Presumably we would be if they're on the pump for a long time. And most critically, they have to have adequate supplies to get them through their hospital stay. If they don't have an adequate number of infusion sets and reservoirs and batteries, even if they want to continue, it's not safe to continue because you don't want a sudden crisis of the pump stopping. The second thing is, do you have the appropriate professionals to support the patient with diabetes while they're in hospital on the pump? That is the nurse specialists from the diabetes center who are pump experts, and either an endocrinologist or an internist with an interest in diabetes who can appropriately help to manage the patient. And you must have appropriate policies and procedures in your organization and have already undergone the education for your nursing staff so they can be comfortable with the concept of someone maintaining or managing their insulin while on a pump. And finally, they have to have a medical condition that will allow it to continue. So if they have DKA, whether or not they want to continue the pump, it's not possible because it's not safe. If they're confused or disoriented, if they have a severe medical condition that requires admission to ICU, any of these, you could not continue the pump. If they're unable to self-manage for any reason, whether they become confused or they have a psychiatric illness that impairs their judgment, all of those are reasons not to continue the pump. And if they're a child and predominantly the family is helping to control the pump, if the family is not available 24/7, you can't continue the pump. So those 3 situations, the patient, the organization, and the reason for being there, are the 3 things you must consider in continuing to use the pump in hospital.
In suspending the pump or disconnecting the pump, there's 2 options you can do. There's one where you hit a series of buttons on the pump, and there's an option to suspend, which suspends the insulin flow into your body. And then there's the other option, which is just disconnecting the actual site off your body and stopping the flow of insulin.
So there's, with the pumps that have tubings, the Animas, the Medtronic, or the Accu-Chek Spirit, There's kind of two main infusion sets that are attached to the patient. One would be, looks like almost like a buckle, and that you're just going to squeeze and pull that out. So I'll just show you that again. It's in. You're just going to squeeze. It's kind of ribbed. You're just going to pull that out. Then the patient is detached. The other may have something that looks like this. I kind of think of this as like a button. If that's the case, all you're going to do is you're going to twist and line up the two arrows and pull it off. The patient's no longer getting insulin. Something else that you could do, let's say you're fumbling, you're not sure. Really, all you have to do is rip it off. There's no needles. All there is a plastic cannula that's inserted in the patient. It's the same thing as taking off a Band-Aid. If that doesn't work and you have a pair of scissors, you can go here, go to the cut close to the edge of the pump, snip the tubing, and now you no longer have the insulin infusing into the patient.
I mean, when you're suspending the pump, you're just stopping the flow of insulin to a patient. When you're disconnecting it, then it's physically coming off of their body. You would disconnect it if you didn't want that on their person. So, for example, if they're going for a procedure and it's not safe for the pump to be in to be in the room with the procedures, like if they're having an MRI. Or if they're going for surgery and there's concern that it's in the sterile field and needs to be removed for surgery.
In preparing for minor elective procedures or surgery, it's important to plan ahead. Let the healthcare team that's performing the procedure or surgery know about the pump and the diabetes, and work with the diabetes team to make a plan. The most likely plan is that the pump will be disconnected just before the surgery and reconnected just after. For emergency surgery or trauma, these things can't be planned ahead for. So what will happen is the pump would be disconnected and insulin would be supplied by the care team through an intravenous. At this point, it would be important to contact the diabetes specialist, the physician that's helping manage the diabetes, in order to help manage the insulin for that procedure. In terms of if there's a major elective surgery, you have time to plan. The diabetes specialists like the pediatrician, the internist, the endocrinologist should be involved in helping to plan for the diabetes management around the surgery. And again, the pump would be disconnected, would not go to the operating room, and insulin would be supplied through the IV.
Hypo means low, hyper means high. So someone who's hypoglycemic means that their sugars are decreased. And having low sugars creates a stress response in terms of having shakiness, feeling the need to eat something. Your brain is solely dependent on sugars as an energy source. And so if sugars are low enough and your brain doesn't get those sugars, it starts to malfunction. And that's why we start to see confusion and even loss of consciousness.
If the person's conscious and has a low blood sugar or is confused, then they need help to treat their low blood sugar. So the first step is to get them something that contains carbohydrates to drink. So like juice or regular pop, anything that has sugar in it. Then the next step would be to disconnect or suspend the pump. So if the person can't do it for you because they're too confused, you can just disconnect the pump.
And so in certain instances, as if, for instance, if the person is hypoglycemic, suspending the pump is the ideal way to manage that. And then you would go on with your usual hypoglycemic protocol. Now, as a first responder, you're not going to know how to suspend a pump. There are many pumps out there, and the way you get to that button is different. But if you have a patient who is alert and oriented, or a family member who is present and understands the pump, it is very appropriate to ask them to do so and to be involved with the discussion about whether it's appropriate to do so. I would only snip the tubing if the person is unconscious, unable to cooperate, and no one else is around to help you. I would not get involved yourself with trying to figure out the buttons. You just couldn't know all the pump companies and the mechanisms. But if someone is awake and alert, or there are family members who are present, certainly involve them in the decisions, because they are very capable of helping you out.
If you come across a person who's unconscious, the first step is always to activate emergency health services, call 911. Then with a pump, just like anyone with diabetes, the problem may be a low blood sugar. So if you have access to a blood sugar testing meter, a glucose meter, test the blood sugar. If the blood sugar is under 4, that's a low blood sugar and needs to be treated. Then the next step is to disconnect the pump, or so either disconnect it at the site or suspend the pump. Best thing is to disconnect it. And then what you want to do is, if someone nearby has glucagon with them, then that should be used to treat the low blood sugar. If not, which would be usually the case, you wait for emergency health services to arrive to help and just put them in recovery position. It's important not to put anything in their mouth. Don't try to feed them because they may choke.
Hyperglycemia is the opposite. The sugars are elevated, and high sugars in patients can make them feel thirsty, run to the washroom, empty their bladder more. The concern with high sugars, if they're not treated appropriately in a type 1 diabetic, is that person develops a form of severe hyperglycemia, which we call diabetic ketoacidosis.
So if the person is unconscious and we know that the blood sugar is high or above 14, then the important thing is that they need to get quickly to emergency health services. They need insulin, but putting insulin through that pump site is not going to be effective, and it shouldn't be the route that you go. The most important thing is to get them to emergency services, like an emergency department, as soon as possible. If you're asked to help a person with diabetes on a pump whose blood sugar is high, above 14, and they're conscious, then the problem there is that they need insulin. The most likely thing is that their pump site is not working. So they need insulin by an injection, and then they need to change their pump site. If they look unwell, then they need to go to an emergency room because they're at risk of diabetic ketoacidosis, and that requires treatment in the hospital.
When a person with diabetes presents with diabetic ketoacidosis, the treatment of diabetic ketoacidosis requires intravenous insulin and fluids. It is not appropriate for a pump to be continued at that time. So the pump must be discontinued and removed until the sugars are stabilized. Further on in the hospital stay, once everything has settled, the pump can be restarted. But for the management of that particular illness, it cannot be. There should be protocols present in every emergency room and a health authority for the management of diabetic ketoacidosis in children, young adults, and adults.
The diabetes educator team, I have a doctor. Obviously I'm an adult now, so I'm at the QE2 and they have resources, but there are also trained diabetes educators and trained pump specialists who are very open to questions.
The most reliable sources are from diabetes educators, for sure certified pump trainers, which there are all over the province, family doctors, physicians. They have some limited knowledge. There are certainly the pump companies have people that work for them that are not only just the sales force, there are people that are clinical specialists. But really, I would say your diabetes educator, especially your certified pump trainers, are going to be your best, most reliable source of information.
So if I could give one piece of advice to healthcare professionals is don't be confounded by the technology. Remember, it's just real-time delivery of insulin. In fact, it gives you an advantage. If someone has already given themselves an injection 6 hours before, there's really nothing that you can do except react to what has happened. But someone is being given insulin real time. In combination and collaboration with the patient, you as a healthcare professional can intervene. We will never ask you to get involved with the operation of the pump. We just ask that you understand how the pump works in collaboration with the patient with diabetes.